Okay, so let's talk about something that a lot of us have either experienced or, let's be honest, worried about. You're just going about your day, maybe in the shower or looking in the mirror, and then you feel it. A little lump in your neck that wasn't there before. Your mind can definitely start to race, right? But what's actually happening from a doctor's point of view? Well, today, we're going to solve that mystery. So, you find a lump. The first and most important step is, of course, seeing a doctor. But what happens then? What's the actual process that turns this unknown thing into a known diagnosis? Let's dive in. All right, the first thing you have to understand is that a doctor's job isn't to just take a wild guess. Think of them more like a detective. They're faced with a mystery, the lump, and they're about to start a very careful, step-by-step investigation to figure out what's going on. And like any good detective, where's the first place they're going to look for clues? Well, it's the primary source, you. Your story, your history, and a physical exam. That's the foundation for this whole investigation. This first part, the questioning, is absolutely crucial. They're going to want to know everything. When did it pop up? Has it gotten bigger, smaller? This gives them a timeline. Then, are you having any other symptoms? Like a fever or losing weight? That could point to something like an infection. And yes, they're going to ask about your habits, and this isn't just a lifestyle lecture. We know for a fact that things like smoking or heavy drinking can seriously irritate the tissues in your throat over many years, which can increase the risk for certain problems. So that context, it's a vital clue. Next up, they're going to do a hands-on examination, and every single thing they feel is another clue in the case. Where is it? Right in the middle of your neck or off to the side? What does it feel like? Is it soft and squishy, or is it firm, or even rock hard? Can they move it around, or does it feel stuck in place? These physical traits aren't random at all. They point towards completely different types of conditions. So all of this information, your story, the exam, it lets the doctor do something incredibly important. It helps them take a huge list of every possibility under the sun and narrow it down to a much shorter, much more manageable list of the most likely causes. And this brings us to what's officially called a differential diagnosis. But honestly, let's stick with our detective analogy. It's the suspect lineup. Based on those first clues, the doctor starts to identify the most probable culprits. Now, this is where it gets really interesting, because you can see how specific clues point to very different suspects. Take a look at this. A young adult comes in with a lump on the side of their neck. A top suspect? A branchial cyst, which is usually benign. But now look at the next one. An adult over 40, a smoker with a hard fixed lump. That's a red flag. That points toward a possible metastatic cancer, and that needs to be investigated urgently. A lump in the middle of a child's neck? Could be a thyroglossal duct cyst, also typically benign. And what if a lump swells up and gets painful whenever you eat? Well, that sounds a lot like a blocked salivary duct. See how it works? But here's the thing. This lineup is an amazing tool, but it's still just a very educated guess. A detective can't just arrest someone based on a hunch, right? They need hard, physical evidence to be sure. So how do they get that proof? How do you go from, I think this is what it is, to, I know this is what it is? Well, you have to move from looking at the outside clues to actually looking inside the lump itself. And this is where the forensic tools of modern medicine really shine. We're talking about technologies that let doctors see the lump's internal structure and even identify the exact cells it's made of. This is how they get the hard evidence they need to make a final diagnosis. The first tool they'll often reach for is an ultrasound. It's totally non-invasive. It just uses sound waves to create a picture of what's going on inside. And its main job is to answer one really simple but really vital question. Is this thing solid, or is it just a fluid-filled sac, like a cyst? Just knowing that one thing can narrow down the possibilities in a huge way. Okay, so what if the ultrasound shows the lump is solid? Well, the next crucial step is often something called a fine needle aspiration, or FNA. A really thin needle, usually guided by the ultrasound, is used to take a tiny sample of cells from right inside the lump. Those cells then go to a pathologist, who looks at them under a microscope. This is like getting a cellular fingerprint. It tells you exactly what kind of tissue you're dealing with. And what's really brilliant here is that the results aren't always just a simple yes or no. For certain things, like thyroid nodules, all the evidence from the ultrasound and the FNA is plugged into a standardized system to calculate a very precise level of risk. So this is a simplified look at a system doctors use called TRADS. Based on all the evidence, a lump gets categorized on a scale from benign all the way up to highly suspicious.
Now, this score isn't the final diagnosis itself, but it creates a super clear evidence-based roadmap for what to do next. It tells you if you can just watch it or if you need to move on to something like a surgical biopsy.
And finally, all the pieces of the puzzle are assembled. The detective, your doctor, takes your story, the physical exam, the imaging, the cell analysis, and puts it all together to solve the mystery and arrive at a final confirmed diagnosis. And that diagnosis leads straight to a logical plan. And it's really important to know that plan isn't always surgery. For a lot of benign things, it might just be watchful waiting. We'll just keep an eye on it. If it's an infection, the plan is medication. And yes, for lumps that are suspicious or confirmed to be malignant, the plan might involve a biopsy or surgical removal. So the whole point of this entire process, from start to finish, is designed to do one thing. It's to take the anxiety and fear of the unknown and replace it with the clarity of a known condition and a clear, straightforward plan to deal with it. So, at the end of the day, finding a lump is really like discovering a question that your body is asking you. It is not an automatic sentence. The incredible, methodical process of medical investigation is how we find the answer. And the very first step in that whole process, it's the simplest one of all, just asking for help.